Welcome to This Week in Surgery Centers. If you're in the ASC industry, then you're in the right place. Every week, we'll start the episode off by sharing an interesting conversation we had with our featured guest, and then we'll close the episode by recapping the latest news impacting surgery centers. We're excited to share with you what we have, so let's get started and see what the industry's been up to. Hi, everyone. Here's what you can expect on today's episode. We are carrying on with our series on improving profitability. Last week, we explored how AI and automation can boost your ability to collect outstanding balances with Melanie Howitt. This week, we have Kristle Young from Collective RCM on to share some tips on how you can reduce days in AR. In our news recap, we'll cover a few trends from the annual ASCA Conference, shoulder replacement growth, a new joint venture agreement between Cleveland Clinic and Regent Surgical, and of course, end the news segment with a positive story about this year's recipient of the Knapp Gary Award. I hope everyone enjoys the episode, and here's what's going on this week in surgery centers.
Kristle, welcome to the show.
Yes, thanks for having me.
Kristle, before we dive right in here, can you give us just a little bit of an overview on Collective RCM and your role with the company?
Absolutely. Yeah, so again, my name is Kristle Young. I'm the Chief Operating Officer for Collective RCM. We are a full service revenue cycle management company located here in Plano, Texas. And we've been in business for, 15 plus years, but our staff together has about 35 plus years in RCM experience. I myself have been in healthcare for 30 plus years. We focus pretty much on hospitals, ASCs, laboratories, intraoperative neuromonitoring services, physician groups. And again, we do everything from A to Z, all the way from patient financial clearance, all the way through posting and patient financial services. So we are definitely a full service revenue cycle management company.
Fantastic. And wanted to ask you about a couple of metrics and KPIs today as it relates to the RCM process and get your take as an expert in the space. And then thought we could also touch on HST's State of the Industry report. We've got some good data from our customers and thought we could interweave some of those stats into the conversation as well. And so if we jump into it, if we think about the revenue cycle process, days in AR is a North Star metric for a lot of our customers looking to manage that down, right? And so why is reducing days in AR so critical to the overall financial health of an ASC?
Sure, absolutely. So as we know, days in AR is really a key indicator of how efficient an ASC is converting services into cash. So if you have an ASC where there are high AR days, you automatically, that means delayed cash flow. And that is a huge pain point for an ASC. The more days in AR, you're going to have more write-offs, potential liquidity issues that can impact your operations. And outpatient ASCs, they have some tight margins, right? So faster reimbursements are crucial for their cash flow because they've got to be able to reinvest back in supplies, their staff, their patient care. So always the goal should be shorten that revenue cycle, maintain compliance and accuracy, and keep that cash flow coming in very quickly.
Right. And if we tie this to our State of the Industry report that I mentioned, we found that 30% of AR from the customers we sampled is greater than 90 days old. And so if you think about that, greater than 90, we typically want to avoid. What are some of the most effective strategies you found in terms of lowering those days in AR?
Sure. Yeah. So as we just said, aging AR is a major red flag for an ASC, right? And statistically, when a claim gets in that 90-day range, your chances of collecting on that claim can reduce down to 30%. So you obviously don't want it to get there. So effective strategies for keeping it out of that range. One important thing is pre-service financial clearance. You want to make sure you're verifying your patient's insurance, that you're checking to see whether the patient needs an authorization for their upcoming service. And also, it's very important to have a strong patient cost estimate process in place where you are able to get that patient their financial patient responsibility ahead of time so that patient can make an educated decision about how they're going to pay that deductible or that coinsurance. You don't want your patient coming in that morning and being hit with an unexpected large amount because there's enough stress that the patient's going through, right? They've got surgery. So as soon as a patient gets put on the schedule, getting that cost estimate done, making that phone call to the patient, and then giving them options, right? So either offering them a payment plan with yourself, the ASC, obviously ideally is to get it all up front, but also offering them a payment plan option or payment. There's companies out there that'll finance patient responsibility as well. So that is a very effective strategy because if you don't get authorizations, then you're going to get denials, you're going to get your claims in those 90 plus days AR, and you're not going to get paid. Another effective strategy is just being very proactive on your claims management. Try to submit clean claims first. You really want your RCM company to be at about a 98% clean claim rate. And also be very diligent in tracking your denials because your denials indicate your foundational workflow, right? If you have a lot of denials and authorizations, then obviously your pre-service financial clearance protocol is broken, right?
Yeah.
You
Yeah.
want to fix that foundational issue. So proactive claims management is important. Automating claim edits and scrubbing can significantly cut down on rejections, getting those clean claims out right away where they don't get into your older days of AR. Another strategy is having patient payment optimization. Again, offering easy digital ways for the patients to pay, setting up automated payment plans. Because if you don't get that patient payment, then you're going to result in a lot of your claims being partially paid, right? So, and you want to communicate clearly with your patients about their responsibilities up front. And again, having a dedicated follow up team on claims. You can use automation where you can have your automated tools automatically go out and check on claim status to proactively look and see, hey, is it paid? Is it in the process of paid? Is it denied? Is it looking for a medical record request where you're not waiting for that correspondence to come in the mail? That can reduce your days in AR. But having a very focused team that is structured around looking at claim status, paying attention to how your payers pay. So if Medicare pays within 14 days and you have a claim sitting out there at 45, you shouldn't let it get to that point anyway. But look at your payer reimbursement timeframes and pay attention to when they normally pay, their normal trends, so you know what to follow up on.
Fantastic. And so, as you'd expect, there's a lot in there to optimize, right, in terms of the effects, days, and AR. If you were to pick out maybe 2 or 3 leading indicators, right? So we have days in AR, but are there some leading indicator KPIs, whether that's around clean claim rate, as you mentioned, or denial rate? Are there any leading indicators that you would look at to say these are the 2 or 3 most important that will predict and impact days in AR?
Yeah, I think one of the main leading factors is that pre-patient financial clearance step. Because if you maybe the patient gives you some insurance and it's not even active, right? And then you weren't effectively checking because every payer is different on whether they need an authorization or not. I think that is a number one thing, making sure that pre-foundational patient verification, authorization process, and providing cost estimates because you don't want to try to collect that money later and patients can take a long time to pay or not pay at all. So that's one. And then I think the second thing is that really that claim proactive follow up. That is key because if you can react to a claim quicker and waiting for, like I said, correspondence to come in the mail, the chances of you getting that cash flow in faster is huge, huge.
Okay, great. Wanted to ask you about another stat and trend we found in HST's State of the Industry report. And so in that report, we saw that we looked at 2003 to 2004, so year over year, there was an increase in partial payments from 41% to 56%, so 41 to 56, but a decrease in total payments from 26% to 17%. And those payments combine both the payor side and the patient side. And so, any thoughts on why that may be the case in terms of lower overall payments, but more partial payments?
Sure. Yeah, I think there's several factors that could contribute to this statistic. I do think that higher patient financial responsibility is becoming an issue because
Mm-hmm.
insurances are just not as good as they used to be. Like I said,
Mm-hmm.
I've been in healthcare for 30 plus years. I'm like, man, the insurances don't cover what they used to be.
Yeah.
So you got rising deductibles, you got rising coinsurance, rising copays. I think more patients are struggling to pay their balance. So I think that is leading to increased partial payments. So again, it goes back to my importance that I stressed earlier about having that conversation, that financial transparency conversation with your patients, and maybe having outside patient financing options for your patients. Then the ASC doesn't necessarily have to carry that burden, right? They may experience a small haircut off the top, but it may be worth it for them. Their profit margin may still be good enough where they would rather have 4,500 instead of 5,000, lose that $500 to ensure that they get that payment up front. So I think that is encouraging a part of a reason for partial payments. I think there's also payer reimbursement challenges. A lot of payers are pushing back with lower allowable amounts. Again, it goes back to payers don't want to pay. They're in it to make money, and they're going to push back with lower allowable amounts. They're going to try to increase your denials. They're going to ask for medical records to hopefully delay the payment, or hopefully that you don't respond to a medical record request. And then it's funny, with all the automation and everything that's going on, I think we're also seeing slower payment processing from payers. And then I think too, there's a shift in payment models. I think ASCs are seeing more bundled payments. So your total payment is going down because they're saying, well, this is bundled together. That's a factor. I think improper coding combinations can cause this to happen, can decrease the overall total payment while only making a partial payment. Also, medical record documentation is key to support the code that you build, right? So they may ask for medical records, and maybe that medical documentation doesn't support the full payment on the claim. Maybe you build something, you did something, but you didn't document it. So medical documentation is key. And then also just, I think, economic pressures. Again, this goes back to patients' ability to pay. We've got inflation, we've got financial strain on patients, and in fact, that impacts their behavior on how they're going to pay. So again, I think strengthening upfront collections, streamlining patient financing options, and also being proactive as an RCM company and encouraging your client or your ASC to be very proactive with your contracts. Payer negotiations are key. And also, an RCM company needs to monitor contract management, right? So having a practice management software that allows you to load in the contracts, that shows the true allowables that this ASC is supposed to get, is crucial, right? Because you may think you got $60,000 for the claim, but maybe the insurance was supposed to pay $65,000. So you have to monitor that you're getting paid what you're contractually supposed to be getting paid.
Yep.
So I
Yep.
think those are the
That seems
things
like
that can be
another good.
contributing to those statistics. Yeah.
Sure. Follow-up question for you. You touched on patient financing options. What have you seen to be the best options in the market?
There's a lot of different options out there, but I really think the most effective strategy for an ASC is to look at outside patient financing options. There's a lot of companies out there trying to get that burden off of the ASC because a lot of patients want a payment plan, right? And I've seen in my experience, you can get a patient on a payment plan. They'll maybe pay, they'll be good for about 3 months after their surgery, and then they just drop off the planet. right? So it's very effective to the financial health of your ASC is to provide that patient. There's obviously Care Credit. Experian, I think, offers some options. I'm drawing a blank on another one, but there are a lot of options out there that you can engage with. And it's a very small percentage off for the ASC, but they're getting that money up front.
Sure. Yep. Yep. Got it. Okay. So we've touched on several of the factors that are important to driving down days in AR. If we look at that from the vantage point of what's the most inefficient today, is there anything that you'd call out in this overall RCM process that's inefficient for a lot of centers today?
Yeah. So I think again, one of those things that, when we come in and we're asked to engage with the new ESC, we see a lot of claims in AR, and a lot of them are just simple denials for authorization, and that is such an easy fix, right? But they don't have a front office staff, or they don't have an RCM team really thoroughly engaged in making sure that pre-financial patient clearance is performed accurately. They just maybe assume that, well, United Healthcare didn't need an authorization for a total knee. So they assume that Blue Cross doesn't need an authorization, right? You
Yeah.
have to be very in tune to that. And my rule of thumb is, even if you think that you haven't had authorizations needed on a certain procedure for a certain payer, you check anyway, because that patient may have a unique insurance that is a little bit different, and they do require that authorization. So I think one of the major inefficiencies I see is just that patient pre-verification financial clearance is one. Inefficient charge capture and coding errors is also an issue. So if you don't have good preference cards and your nurses aren't documenting all your supplies or your implants, we could be missing supply charges or missing billing for an implant. And then also having a good coding company, coding team that's going to make sure that everything is coded to maximize reimbursement, right? Or coded correctly so you don't get a denial. Regular audits using AI assisted coding tools can also improve that accuracy. AI and automation is just a huge topic right now, right? So the more you can utilize AI and automated processes, the better you're going to be.
And where specifically, because everybody's talking about AI, and where does it come into play in revenue cycle and elsewhere for an ASC? Where specifically do you see the most potential for AI within the revenue cycle process?
Well, I think analyzing denials is huge, right? And being able to look and see what denials are really hitting your ASC and drilling down on what those are and fixing the foundational root cause of what's causing them, right? But you can use AI in a lot of different places. The automated claim status follow ups, where you used to be able to, you'd have to have 30 collectors, right? And they're picking up the phone and they're calling Blue Cross, they're on hold for 2 hours. You have that automated AI claim status tool, right? It drastically, and it spits back a report for you, and you just took care of looking at statuses on 50 claims in an hour versus 10 people having to make phone calls. So it's a huge improvement in cash flow. Using AI tools for checking verification benefits, checking to see if an authorization is needed, automated posting of denials. If you get that automated posting quicker, then you can react to that denial faster and fix it. And that improves your cash flow. Just sending out automated messages, doing an automated AI message to your patients. Hey, you have a payment plan. You're on a payment plan. You have an upcoming payment due on May 15th. Just wanted to remind you. There's all kinds of things. AI can also start to be used in preparing appeal letters. If you have a certain denial, maybe for medical necessity, you could have an AI tool that can also build that appeal letter, go and grab medical records, prepare that packet for your collector, and they just have to review it. Again, faster turnaround time on any appeals you might have to write. But in addition to that, other inefficiencies, again, lack of structured follow-ups. I've hit on that a few times here, but you've got to have a strong process for payer follow-ups. So to lead into that, again, that AI automated claim status tool is just a game changer.
Fantastic. Kristle, one more question for you, and we do this with our guest each week. What's one thing our listeners can do this week to improve their surgery centers?
Yeah, I think an actionable step that an ASC could take as a project is go in and audit their top 10 unpaid claims over the last 90 days. Try to identify some common trends across those top 10. And I bet you're going to find a very core foundational issue, whether it be authorizations that were missed, or is it a certain payer that's just constantly asking for medical records, or is it a certain payer that's not paying on time, or just is it coding errors? Just really drill down and see why they're not paid, because I guarantee you'll find a core foundational issue that can be addressed on the front end that can fix that problem.
Fantastic. Kristle, thanks so much for joining us today.
Yeah, thanks for having me. I appreciate it.
As always, it has been a busy week in healthcare, so let's jump right in. ASCA's annual conference was held from April 30th to May 3rd in Colorado and brought together thousands of ASC industry leaders. I personally had such a great time at the show, and a huge thank you to all of you who came to the HST booth to chat and share positive feedback about the podcast. Sometimes I feel like I'm just talking to myself out here, so to be able to talk with so many listeners was so much fun for me. Aside from that, though, here are 4 themes and key takeaways from ASCA 2025. The first, data, automation, and tech adoption are non-negotiable. Across the exhibit hall and breakout discussions, the message was consistent. Tech-enabled ASCs are better positioned to succeed. Automation is transforming workflows from streamlining revenue cycle processes and clinical documentation to improving inventory management and reducing compliance risk. Data analytics was also front and center, with many leaders looking for smarter ways to track KPIs or key performance indicators and spot operational inefficiencies. So the main takeaway was clear here. Embracing the right tools isn't just about efficiency. It's essential for scaling your ASC, staying compliant, and meeting the growing demands of patients and payers alike. The second key theme that I saw was that leadership development is super important amid staffing shortages. So, with staffing shortages still top of mind, many conversations and sessions focus their attention on how to build resilient teams and retain high performers. Leadership development emerged as a top priority, with discussions around how emotional intelligence, thoughtful delegation, and structured evaluations can create a more stable, supportive workplace culture. There was broad recognition that a strong leader doesn't just manage operations, right? They influence retention, morale, and the long-term health of the center. So culture, communication, and team alignment are just as important as clinical outcomes when it comes to ASC success. The third theme that I noticed, leading ASCs focus on maximizing profitability and long-term value. So, a key theme across the conference was the growing emphasis on strengthening financial performance and planning for long-term success. Attendees and vendors were all talking about how you can focus on strategies to improve payer reimbursement, increase revenue per case, and enhance overall profitability. There was a strong push towards mastering financial data, so from understanding statements to analyzing cost drivers to better inform operational decisions. Related hot topics included real estate monetization, growth planning, and preparing for a potential sale. Financial literacy is clearly becoming a competitive differentiator for ASC leaders aiming to scale or future-proof their organizations. And lastly, total joints continued to take center stage. We talked about this in our recap last year, and I'm sure we will be talking about it in our recap next year. So, total joint replacements, hot topic among attendees, exploring new service lines. Many were exchanging advice on launching and scaling outpatient joint programs, from building out infrastructure to navigating payer relationships and optimizing patient outcomes. The conversation emphasized that high acuity growth is possible with the right clinical, operational, and financial foundation in place. Many sessions covered certification processes, patient selection, and staffing models to support success. With strong interest in ortho expansion, total joints were seen as a major opportunity, especially for ASCs ready to invest in long-term differentiation and value-based care readiness. Now, that is really just the tip of the iceberg. When it comes to what else was covered at ASCA, there were so many great sessions. The keynote speaker, Melissa Stockwell, was amazing. All the parties and networking events were great. It really was a fantastic week. And once again, thank you to ASCA and everyone who puts in so much time planning and running the event. It was a huge success, and we're already looking forward to DC in 2026. All right, next story. Shoulder replacements are quickly catching up to hips and knees in the outpatient surgery world, despite being approved by CMS years later. Doctors speculate that shoulders have been a bit behind because patients can live with a bum shoulder a little easier than a bad hip or knee. But that mindset is shifting, and it seems to be shifting fast. Recent data showed that more total shoulder arthroplasties, so TSAs, are being performed overall, and even more patients are being discharged home from inpatient cases on same-day basis. The 2019 American Academy of Orthopedic Surgeons Shoulder and Elbow Registry shows that 71% of patients were discharged to their homes from 2015 to 2020 same day, and from 2020 to 2023, 79% were discharged within the same day. Another important piece is just educating patients on how well suited shoulder replacements are to the outpatient setting. Surgeons like Dr. David Dare, North Carolina, and Dr. Corey Reed in Buffalo say the procedure is often less painful than other shoulder surgeries, especially with nerve blocks that reduce the need for post-op pain meds. Patients go home in a sling, feeling little to no pain, and don't require the intensive recovery that comes with hips or knees sometimes. The key to success, though, standardized protocols, streamlined trays, and clear patient education. At Excelsior Orthopedics, they've built a program around consistency. So the same instruments, same instructions, same equipment, making it easier for staff and very predictable for patients. And as Dr. Dare put it, my patients are resting at home 2 hours after I make the incision. It's a complete paradigm shift. So what does this mean for ASCs? Shoulder replacements represent a major growth opportunity. With improved pain management and strong patient outcomes, TSAs are a perfect fit for surgery centers. And for centers already doing rotator cuff repairs, adding shoulders may be less of a leap than you think, and could be the next big move in expanding your already existing orthopedic service line. All right, third story. Very exciting news for the ASC industry. Cleveland Clinic, one of the most respected names in healthcare, is teaming up with Regent Surgical to expand ASC access across the U.S. The partnership, announced May 7th, is focused on developing new ASCs and strengthening Cleveland Clinic's outpatient care delivery. Cleveland Clinic is a nonprofit academic medical center and research powerhouse with over 82,000 employees, nearly 6,000 physicians and researchers, and more than 280 outpatient facilities. In 2024 alone, the system handled over 15 million outpatient visits and performed 320,000 surgeries and procedures. And then Regent Surgical, who's based in Franklin, Tennessee, manages ASC partnerships in 13 states and is no stranger to high-profile collaborations. Earlier this year, they also partnered with Mass General Brigham to grow ASC services in New England. So with Cleveland Clinic as the majority owner in the new venture, all ASCs will carry the Cleveland Clinic brand. The move follows a series of innovative collaborations by the system, including a telehealth venture with Amwell and a partnership with Amazon's One Medical. All right, so why does this partnership matter? It really just signals a continued shift. Major health systems aren't just embracing ASCs, they are doubling down and fully investing. By partnering with specialized operators like Regent, they're looking to scale quickly and can do so strategically. For ASC leaders, this is a clear sign that the future lies in collaboration, brand strength, and meeting patients where they are, efficiently, affordably, and closer to home. And to end our news segment on a positive note, at the ASCA 2025 conference in Colorado, Kathy Wilson was honored with the Knapp Gary Legacy Award for Lifetime Achievement in the ASC community. The award, presented by Dr. David Shapiro, recognizes individuals who exemplify integrity, leadership, and commitment to quality and safety in ASCs, and honors individuals with at least 15 years of service. Wilson most recently served as executive director of the ASC Quality Collaboration from 2021 to 2025, where she oversaw operations and advanced quality reporting efforts in partnership with federal agencies. Her work significantly shaped the ASC QC's national influence, especially in educating stakeholders about CMS's ASC Quality Reporting Program. Previously, Wilson spent nearly a decade at AmSurg, where she developed a quality and risk management program for over 260 surgery centers and created a comprehensive data repository. Before that, she held leadership roles at HCA Healthcare for over a decade. Wilson expressed a deep gratitude for the recognition and shared the honor with fellow quality and safety professionals in the field. Her decades-long dedication to advancing outpatient surgery standards earned her the unanimous vote of ASCA's board of directors. Now, I have had the pleasure of working with Kathy directly and can personally attest to just how knowledgeable, brilliant, and kind she is, and this award is so well-deserved. And that officially wraps up this week's podcast. Thank you, as always, for spending a few minutes of your week with us. Make sure to subscribe or leave a review on whichever platform you're listening from. I hope you have a great day, and we will see you again next week.